All right, hello everyone, and welcome to this year's first Reach Out and Read Wisconsin webinar. I'd like to introduce today's presenter, Jessica Newman, a Training and Quality Assurance Manager with United Way Wisconsin and 211 Wisconsin. Jessica will be sharing how your clinic can utilize 211 Wisconsin as a resource for a number of different needs for the children and families you serve. This builds upon last year's Reach Out and Read annual meeting theme of building a net of support. Before we get started, I'd like to just go over a few housekeeping items. So all participants are muted upon entry. Please, throughout the presentation, as you think of questions, use the chat box to ask any questions or comments that you have. The chat box looks like a little conversation bubble and usually the bottom of your Zoom toolbar. I'll read the questions aloud for Jessica at the end of her presentation. And lastly, this webinar is being recorded and will be posted to our Reach Out and Read Wisconsin YouTube page so that you can watch again or share with your colleagues. And with that, I will turn things over to Jessica.
Thank you so much, Amber, and thank you everyone who is here today. I'm glad to share with you about 211, which is definitely there to help within the safety net. We know that through your conversations with individuals within the clinic walls, whether it's through a telemedicine appointment or even through emails that they're sending you, you are finding needs that people are revealing to you, and you don't always have the resources within the clinic, and we want to make sure that you know that 211 is there to be a part of that safety net to support you and your patients in connecting with community resources. So thank you for the opportunity to be here today. And I will share with you an overview about 211, and then we'll dig into how you can connect patients, whether it's you directly or some of your supports within the clinic or the patients themselves connecting with 211. And if there's time, we do have some other things to share as well. So as Amber noted, please do put your comments in the chat and we will have a question section at the end. So I want to make sure that we're setting a base foundation for everyone as we talk about 211 today, to make sure that everybody understands what 211 is and how it works within the state of Wisconsin. 211 is a national FCC regulated 3-digit number, just like 911 or 988. It does cover 96% of the United States population. You can see that there are areas where it isn't covered, 100% in Illinois, Ohio, and Georgia. Those are also supported by another FCC 3-digit number called 311, which is run more from a government perspective than from a nonprofit perspective. I will say this number is actually going to increase in the coming months. Chicago is bringing their 211 online in the next few months, so it will be even more than 96% by the end of this year, which we're excited about. While it is a federal number that can be used throughout the states, each state has ownership of the number and who they have support the number. And so in the state of Wisconsin, 100% of our counties, all 72 counties, are covered and supported by 8 call centers that work through a coalition model across the state. So these centers, you can see we kind of have the state divided up. These centers work to manage the resources and our database within those sections, and also mainly answer calls for that area, but also support the state as a whole as the calls are needed. In 211, in the last year, we have been very busy. We have served clients for over 1.7 million minutes of phone contact. We also have had more than 362,000 contacts. That includes inbound and outbound. Our inbound contacts are just over 260,000. And then we also make outbound contacts as well. You can see the total referrals don't equal our 260,000 contacts, because we're often giving more referrals out to individuals within each phone call. They might have multiple needs that we're addressing, so they're getting referrals for each of those needs, or it could be that they have a need that we're able to provide multiple resources for. And so we're trying to give folks the best connections possible. Also, we have a total website search of over 260,000. So we have folks searching on our public database as well, looking for those resources. So you can see that our database is in demand, and the needs for folks, helping folks meet their needs is a real important piece for our Wisconsin communities. When we look at how we serve people, not only do we share those resources with them, but we also collect that data about what the needs are within our communities. And so you'll see the data that I share today will talk about what the top needs are that we're hearing from folks. Our data is what we call indicator data. So it's not empirically researched. It is just a reflection of the calls that we get. So it shouldn't be taken as the end all, but it can inform what the needs are within the community that people are calling for. You can see here in last year in 2022, housing was the top need for 38 of the counties within the state of Wisconsin. Additionally, the mental health was the top need in 20 of those counties. Then moving down, healthcare, which would include COVID needs as well, was a third top need within some of our counties. And then moving down to utility assistance and income support. Now, these are just the top needs in those counties. They are definitely not the only needs within those counties. We know that each of those counties have people that have a breadth of services that they're looking for. And so if we look at our services across 211 for last year, housing was the top need. This is a trend for many years with 211. And then the second top need was mental health supports. This has been a changing need. It's always been in the top 3 or 4, but in the last 2 years, this has moved to be the second need that people are calling for supports in, whether it's mental health or substance use. Additionally, an interesting trend that we have seen is that food and meals used to be number 2 prior to the pandemic, and that now we have seen move to number 5 within the top needs. We anticipate with the ending of the emergency allotments of SNAP benefits that will go back up as a higher need for folks in the coming months when that ends at the end of February. So you can see how we're serving, what the needs are within our community, and how we're able to connect folks. The important piece, though, is, the next piece is we're not only partnering in providing those needs directly, but we're able to partner with other folks to share our database and give access to it. So it's not that it's only accessed on the website, and we'll talk about how you can access it in the website in just a little bit, but we do partner with DHS and other statewide partners. We also partner with Family Services and the 988 Suicide Crisis Lifeline. They use our database to make referrals as well. Our database is also found through third parties like Find Help and Unite Us. And additionally, it is used in direct APIs with organizations like Epic and Theta Care and UW Health. There are lots of ways that 211 can partner across the state, whether it's on projects or sharing of our database. And we are open to that and really want to work collaboratively with partners across the state to address the social determinants of health in our communities to support individuals. Let's dig into, though, really how you can support patients in finding those social support needs. So as we think about the 211, your patient, and becomes our client, we want to make sure that you know there's multiple ways that they can connect with us. They can connect with us on a phone call by calling 211 or our 10-digit number. This could be you, the provider, calling with the patient. It could be your clinical assistants calling in advance to find some resources, or calling afterwards to find those resources and include them in the wrap-up notes for that visit. It could be you calling with the patient, or your clinical assistant calling with the patient in the room, or just making a referral saying you should reach out to 211 to that individual or family. We are here 24 hours a day, 7 days a week, 365 days a year. We know that the needs of families don't have a time or day that is particular. They don't only work 8 to 5. And so we're here to support them in all of those times. Again, folks can call 211 or the 877 number. Additionally, we know that not everybody's ready to talk on the phone. That can be a barrier. And so we're trying to remove that by offering text support. People can text their zip code to 898-211. Additionally, they can live chat on our website, which is 211wisconsin.org. They can chat, and both our chat lines and text lines are manned by our agents in the 211 system, so that they're getting that real human touch when they're connecting with us. And finally, folks can search online. They can go to our website, and we'll dig just a little bit deeper into that in the next slide about how they can search independently and search for resources within their community. We're going to start with the searching online, and then we'll dig further into what the process is of a 211 call in the coming sections. But first, people who want to search independently, whether it is yourself or staff within the clinic, or an individual in need, they can go to 211wisconsin.org and they can go to our website. There's a couple different ways to search on the website. You can search here right on the front page where it says help starts here. You can say I'm looking for and type in food or rent assistance, legal assistance, put those things there and it'll help you populate some of the taxonomy or search terms there. You also can put in the zip code so that we're locating resources that are geographically near you or for sure serve the area that you're looking for. Another way to search that can be useful as well is through our guided searches. So that's at the upper right. And when you would click on the guided searches, there's a drop-down menu. We have several guided searches that are topically based. So we have a caregiver search that is for individuals who are caring for people over the age of 18. And when we talk about caregivers, we think about people who are not only making phone calls and scheduling appointments and giving rides, all the way up to those who are giving care 24 hours a day to adults. So we have a caregiver guided search that was created in association with United Way Wisconsin and United Way Worldwide, as well as AARP. We work with the state of Wisconsin and the Department of Health Services through our WAR, or the Wisconsin Addiction Recovery Helpline. Those can be searched through the Addiction Help guided search. Here, you can search those resources as well. There's a basic needs guided search that has general basic needs listed, like food, shelter, transportation. We have a mental health guided search, so folks can find those supports, because that can be a big and broad search as well. We have relative caregiver guided search. This is for people who are providing kinship care for relatives who are under the age of 18. And then we also have the COVID-19 guided search. When you click into a guided search, you're going to see these topical areas. This is the basic needs guided search. So you'll see that there is some cross linking. We do have mental health and substance use on the basic needs guided search. So we've tried to make sure that no matter where anyone goes on the website, they're able to find what they need and connect to those resources. When you click on any one of these boxes, it will pop open and you'll see that there are some of the top needs that we've seen through calls and internet searches to make sure that people can find those quickly. When you click on those needs, then it will open a search tab and you'll be able to narrow by zip code the resources within the state, and you'll be able to search. You'll find not only the phone number and the address of that service, but you'll find a description of the service. You'll find information on what people would need to bring with them. Do they need to bring an ID? Do they need to fill out an application online? These are the details that separate 211 from just a general Google search. You, of course, can go to Google and search rent assistance for the area that you're in, but you're going to come up with a whole lot and you have to sort through a whole lot of information. At 211, we have dedicated resource managers that are going through and vetting these resources, pulling together all of the information that you might need to confidently refer an individual to another resource that may be able to support them. If the website isn't what you're looking for or what your caller is looking for, if they need more of a personal touch, let's talk about how a phone call works with 211. Phone calls can be made in many different ways. It doesn't need to be, well, phone calls are generally just a phone call, but when you connect with 211, it doesn't need to be specifically the person in need of help that calls. It could be a friend or family member. It could be you as a provider or anyone from your clinical staff that wants to help support an individual, social workers, your clinical assistants, someone at the front desk who someone approaches with a need while they're waiting in the waiting room. 211 is there for all of that support, and we're able to help with that. What happens when someone dials 211 is that they connect with one of our over 500 support teams through 211, and we're able to support individuals on a 24-hour basis. We're able to listen and connect them with community agencies. As we think about this, it's not just a general phone call. We do some assessing. We work with AIRS standards, which is the Association of Information and Referral Services, that has created a gold standard of service for information and referral that is national. And so we're working at that working to those national standards, just like you all have standards of care, we have them as well. And then we look for the assessment of presenting needs and secondary needs, maybe some root causes. If somebody calls and says they need food, we may ask, as the client is willing to answer those questions, what might be the root causes, and if we can bring in other supports. If it is due to a job loss, can we talk about having rent or mortgage support? What about paying for their cell phone or communications during this time? These are the types of supports that we're able to make referrals to through 211. We'll do a brief intervention talking with that individual. We'll then offer a referral to these services. We'll talk about the description of the services, why we think it would be a good referral for them, provide the phone number and any other pertinent information about where to apply. We can also text the referral information out to folks while we're talking to them on the phone, so they don't have to write it all down. We can text or email that to callers. Then we'll offer a warm transfer, and we'll make sure the caller is assured of their next steps. They're confident in taking those next steps. Additionally, we will offer a follow-up. So if it is okay with the caller, we'll circle back and follow up. We'll dig into that follow-up in just a second. The other things that we do within our work is that this database of community agencies doesn't populate itself on its own. That database is created through partnerships with our local community resources, and we share information between the community agencies ourselves and those other organizations. We do this through resource curation workflow that helps us to develop partners. We list things at an agency, site, and service identification levels so that we're able to let folks know that the service is offered at multiple locations or it's only offered at one location. It's all done through a data coding and, again, AIRS standards. Finally, when we think about this, this is a big process. And in order to do that, we have to work through coalitions and build and plan for our system capacity. And so we work with the state. We want to be a collective impact organization with as a backbone of support. 211 is a public-private partnership. We are sponsored majority through private donations to United Ways across the state. Additionally, we do receive some public funding to support special projects. As we think about this process, it sounds like a lot, but truly it is just dialing 211, connecting with one of our resource agents, and they're able to provide the assessment, connection to resources, and this coalition building happens in the background. Once we've connected people to those resources, we want to go ahead and do that closed loop follow-up to make sure that individuals are reaching those resources. So with the caller's permission, we're going to go ahead and do the closed loop follow-up. We're going to follow up on those previous services. We're going to offer additional referrals as needed. If there's any assistance in overcoming barriers, let's say somebody finds they don't have transportation or they need some other type of support, maybe filling out an online form when they don't have internet access, we'll help to connect them with resources that can help with that. We'll offer any additional resources as needed and follow up with those individuals. So that's how our workflow works, but you as a provider and patient, there's multiple ways that you can connect with us. So you can connect on behalf of a patient. 24/7 we're there. You can connect to our regional contact centers and be able to find services to help your patients. We can also develop a referral pathway that can provide triage support and statewide protocols for individuals. We have a couple of projects that we're working on right now that is in that area. Additionally, as I mentioned earlier, we are integrated with Epic and their Orchard. You can use the 211 database through an Orchard app. Additionally, we're integrated with other social determinant of health platforms where the database is right within the EHR and you're able to make those referrals from the clinic room. So 211 is here in many different ways to support you and your patients to make sure that we are a part of that social network to catch folks. I wanted to just check in, Amber, and see if there's any other questions that we can answer that came up during my presentation.
Yeah, so now would be the time to put any questions that you have in the chat, and we do already have a few, so I will just read them aloud. Yeah. So first one is, what circumstances cause outbound calls?
So an outbound call would be used as so if we get disconnected In a call, we would try and attempt to call that person back if we don't know the reason of disconnection. So let's say I'm right in the middle of giving somebody a referral and the phone goes dead, that could be an outbound. Additionally, a lot of our outbounds are those follow-up calls to confirm with individuals that they've reached the services they were referred to and to check in and see if they have any other needs or supports.
Great. Another question, if a clinic is doing a screening with patients for social determinants of health, is 211 a good referral resource to get those needs met that come up during the screening?
Absolutely. 100%. If there are needs that come up during that time, we have health and human service. We have over 30,000 health and human services listed within our database where we can help connect not just those top 8 needs that I showed you in the previous slide, but hundreds of more. I would say thousands more needs that we're able to address within services that are within the database. So absolutely, if there are needs that come up through that screening, please feel free to connect them with 211. What I will say too, though, is that we don't create services. We are a connector of service, connecting individuals to the services that they need. So if it is a known gap within the community, don't be surprised if 211 doesn't have that resource. We may look for a larger regional or statewide resource, but if you have a known gap within your community that there is no services for a particular need, 211 won't magically have one. So we want to be realistic about we're there for existing and new programs that are there.
That's a good point. So for the call, text, or chat features, are there Spanish, Hmong, Somali, or other languages available?
Absolutely. I would say the best case for reaching other language speakers is through our phone option. And we do have translation services that support over 150 different languages. And our prompts are in the 5 main languages that we find within Wisconsin.
And Jessica, can you talk or explain quickly how 211 is integrated into the Epic system?
So I will say that it is you would need to talk with your system administrators for Epic specifically. It depends on which version of Epic you have. And it is through their Orchard app system that you can talk about an API sharing. It gets very technical, but it is something that we're able to do. I know Gunderson system has that, as well as a few others have an API sharing where it's within your electronic health record that you're able to search the database for needs. But it's a very in-depth conversation that goes beyond just the few minutes we have left here. But if you are interested in learning more about that, please feel free to contact me. I know Amber's going to put my contact information in the chat, but please feel free to reach out and we can get you connected to talk more about what that looks like for your system.
Great, and just a couple more questions, and feel free to add any other questions you have in the chat, and Jessica can connect with you after if they aren't able to get answered during this time. If someone is seeking counseling, are specific agencies or offices referred, or how is that person directed?
That's a great question. The first thing that's important to know is that 211 has an inclusion policy that we will include services within a region that have either a sliding fee scale, or they also have the opportunity to, they may be a specialized service within that area. So most of our services are nonprofits, but there are some for-profits within the database that provide services to folks at any income level. So we want to make sure that the services that we're offering are accessible in some way, shape, or form. So there are lots that are within the database. We'll work with the individual to talk about what type of services they're looking to seek. We're working on a new filters option, but we do have things filtered by age groups, the type of therapy that you're looking for, really trying to hone in on all the different types of services that are available. So giving us a call and asking for what you're looking for, and then we can help direct you in that way.
All right, and then last question for now is what kind of services fall under informational services?
That's a great question. So the informational services that you would find in that previous slide that I talked about may be another specialized information and referral service. Within the state of Wisconsin, our ADRCs are which is the aging and disability resource centers within each county have specialized information and referral services for individuals who are aging and disabled. And so we have some similar resources, but not all the same. And so if you're looking for something particular, like an assisted living, we may have some, but we might refer you to your ADRC to find that more in depth. There's also a specialized childcare information and referral service within the state. And so that's where you're seeing us referring out to other information and referral partners that have a better in-depth look at those particular areas.
All right, that's all we have for questions for now. If you want to share your next information, Jeff.
Perfect. Yeah, so I did it because we have just a few minutes left. I do want to share with you in the coming months, I would say starting in February, we are going to have something late February, I would say we will have a new public health dashboard that will be available on 211wisconsin.org. And what this public health dashboard will do will allow you to look at what the needs are live, real time, I should say the calls as of yesterday from your community. It can be sorted by public health region, the call center site. So you could sort it by, let's say you're in the St. Croix region, which is this western part here. You're able to sort it just by those counties. You can look at these specific domains or problem needs and see what's happening throughout the state. This takes data from 2018 all the way until yesterday and puts it live for you to look at and understand what's happening within our communities. With the great piece about that longitudinal look at our data is that we're able to see the changes over time. Here in this top section, you would be able to see that healthcare referral trends. You can see that in March of 2020 through March of 2022, we had significant call volumes around healthcare. We attribute that to COVID-19. You can see another peak here in late last year where we had a higher number of calls around COVID-19 as well. But you can see what those trends are. Over time, we're also able to see things like we are seeing an increase in mental health calls, but we're able to look at how significant that trend has been from 2018 moving forward. We have seen our call volume almost double in what people are calling for around mental health needs. As almost the same with substance use trends as well. We're able to see that the average number of calls has gone up significantly, and also what that looks like year over year. Additionally, we can look at some social determinants of health, what's happening in housing, hunger, and income and job related trends. These can also be narrowed down to your region, so that will be fantastic. And finally, we look at unmet needs, so you can look at why needs aren't being met in your region. This is something that we also collect on phone calls, especially those follow-up phone calls. If you weren't able to receive those resources, was it that there was no program that met your needs, maybe on the initial call, or that the program didn't have availability of funds, or that there was ineligibility because the housing structure does not support your income level? We collect all that information here where you can break that down. Additionally, in the follow-ups, we connect with, did you reach out to the referrals that you were given? And if you were you able to receive help? So you can see that of the 82% of people that allow us follow-ups, 44% of them do receive their need is met. 30% of the need is not met, and we're able to then dig in and help those individuals with that support. And we're excited to share that data all with you in the coming months. So additionally, the last thought I would share with you is that we have a federal grant for a larger partnership, and we are working on developing WIRE, which is the Wisconsin Information Referral Exchange, where we can take 211 data and share it through WIRE. We're partnering with WISHN and other state agencies and regional supports to provide longitudinal personal records where you can also see referral and outcome data. So I know I gave you a lot at the end, but there's a lot that 211 is working on, and we're really grateful to have you as partners.
Well, big thank you, Jessica, for sharing this information with clinics and letting them know how they can use this resource for their patients and families. Thank you, everyone, for joining today. And as a reminder, this is being recorded and will be posted to our Reach Out and Read YouTube page, and you will receive a email notification with the link for today's recording. Also, as a reminder, Jessica's information is in the chat if you do have any follow-up questions. And that is all for today. Thank you all so much. All right. Thanks again, Jessica.
Yeah, thank you so much. We'll connect with you later, Amber.
Yep. Bye.
Bye.